I'm going to explain how Botox can help if you have hooded eyes and how it can help if you have other eye shapes. For example, let's say you feel like your brows are too high and your eyes look too big or too round. Botox can be a benefit to you too. We're also going to go through the different types of eye shapes, brow positions, and how gender and ancestry play a role. I made this video because I commonly have patients come in and they say to me, I want to do Botox here. I want to get a lift. And then I have to explain to them that doing Botox here doesn't actually give you a lift. So we're going to go through and I'm going to explain where you can put Botox to actually get a lift and where putting Botox in does not give you a lift and actually lowers your brows.
Botox or other neuromodulators work by temporarily paralyzing your facial muscles. There are two main muscle groups that affect or alter your brow position, and this is important to know because
your brow position affects how much hooding you have to your upper eyelids. I drop my brows down, my eyes look smaller and more hooded. I raise them up, they look larger and more open.
These two muscles that affect your brow position work in opposition to each other. One muscle raises your brows, the other muscle lowers your brows. The forehead muscle lifts your brows up, making your eyes appear more open and big. The glabella area, which lies right above your brows, lower your eyebrows. When our brows lower, they make our eyelids appear heavier and more hooded. With that being said, the area that you can treat with Botox to give you a lift is your glabella, because your Botox will stop or inhibit those muscles from lowering your brows. When you use Botox to treat your forehead muscle, the muscles that raise your brows, it's going to inhibit your ability to raise your brows. And if you put too much here on some people, it can make their brows feel heavy and look more hooded.
So if you want maximum lift, you treat this area right here, the muscles responsible for you lowering your brows. And then you don't treat any of this muscle right here. This is the muscle that's responsible for you raising your brows. By doing that, you're letting the muscles that are responsible for you raising your brows take full effect. But the problem with that is if you don't put any Botox right here, then you're not targeting those horizontal lines. So it becomes all about finding the right balance. Here are the reasons you want to do Botox to your glabella.
You want your eyebrows to feel more lifted. You have, let's say, a low brow position, or you have hooded eyes. You have downturned eyes. You don't like making the angry face, or you want to treat your 11s, which are these vertical lines right here. In general, a lot of people who have very hooded eyes also have a low brow position. People with hooded eye shapes usually love getting Botox done to their glabella because it prevents them from bringing their eyebrows down even lower. And when they bring their brows down lower, it makes their eyes appear even more hooded.
And here are some reasons you may want to do Botox to your forehead.
You have a high brow position and you want your brows to feel more relaxed. Let's say you have very open and round eyes with a defined eyelid crease. You want to look less surprised or less open-eyed, or you want to treat these horizontal lines here on your forehead.
Now let's talk about how your brow position, eye shape, gender, and ancestry play a role.
The shape and appearance of our eyes have a lot to do with two things. Your brow bone position, which can be low or high, and then you can have in the middle or in between these, and how much fat and skin surround your eyes. Above, we have someone who has less skin tissue and fat density surrounding their eyes, and below is someone who has more skin tissue and fat density surrounding their eyes. Here are the different eye shapes. We have round, almond or upturned, downturned, monolid, and hooded. The monolid and hooded eyes that are on the right tend to have greater tissue densities to the upper eyelid areas than the other eye shapes that are on the left. Here we see an example of the differences in brow position. On the left, you have women with lower brow positions, and on the right, you have women with higher brow positions. Your eyes may appear more open or larger if you have a higher brow bone position and less skin and fat surrounding your eyes. A good example of this is Mila Kunis. Your eyes may appear smaller and less open if you have a lower brow bone position and more fat and skin around your eyes. A good example of this would be Blake Lively. These two things, your brow position and your eye shape, should be taken into consideration when getting Botox or Dysport or any other neuromodulator. In general, men tend to have a lower brow position and a heavier, thicker brow with minimal arch present compared to women. They also usually have a more prominent brow bone or brow ridge, which is bulkier than women. This raised area of the brow ridge is described as bossing, and it's what gives their eyes a deep-set masculine look because it tends to make the face look more intimidating and dominant. Lowered eyebrows are also a sign of a dominant person. Their muscles overlying this area are usually stronger than women's, so they may require more Botox to this area to target their 11s. Brow bones of women are usually flatter without a strong brow ridge, and the muscles overlying this area are not usually as strong as men's. Women also usually have higher position brows with more arch present, all of this giving to a more feminine, soft, open-eyed look. Just something of note, over-elevation of brows or brows that are too arched on anyone, male or female, can create an unnatural, surprised, and unintelligent look. These differences between men and women's brow bones play a big role in sexual dimorphism. Sexual dimorphism is the difference in appearance between males and females, and sexual dimorphism plays a big role in physical attraction. Your eyelids are what give their eyes their shape, and the shape of your eyes have a lot to do with how much fat and skin surround your eyes. The less fat and skin around your upper eyelids, the more open and round your eyes look, revealing a defined upper eyelid crease. Let's go back to the eye shapes. What I want you to pay attention to is the absence or presence of the upper eyelid crease. Here on the left, you have round, almond, and downturn eye shapes. And on the right, you have monolid and hooded. Every eye shape except for hooded and monolid have a pretty defined upper eyelid crease, as you can see. The difference between hooded eyes and monolid eyes are that people with hooded eyes have excess skin to their upper eyelids. People with monolid eyes have excess fat around their eyes, along with what's known as an epicanthic fold. The epicanthic fold is a skin fold of the upper eyelid that covers the inner corner of the eye and is often associated with greater levels of fat deposition around the eyes, a feature most accentuated in people of East Asian, Southeast Asian, Pacific Islander, Native American, Central Asian, and Northern Asian ancestry. Epicanthic folds also occur in some other populations in less frequency, such as in some Norwegian people, such as the Sami, who are indigenous to Finland, Norway, Sweden, and Russia, and some Estonians and Hungarians, and some African populations, such as in some Nilotes, Cushitics, and the Khoisan. Of note, you can have an epicanthic fold and an upper eyelid crease, and an example would be the Taiwanese actress Shu Qi. Statistics show that around 50% of East Asians and Southeast Asians have no upper eyelid crease or a faint crease, with around 75% of Koreans having no upper eyelid crease. The brow bones of people with East Asian and Southeast Asian ancestry are usually flatter than people of African or European ancestry, which tend to give a softer look. Also, they don't tend to need as many units of Botox to the glabella area because their muscles are usually not as strong and are generally smaller.
Now let's look at some real patient examples.
Here we have a patient with an almond eye shape, defined upper eyelid creases, very slightly hooded eyes with a little more hooding to the right side, and a low brow position. She came to me desiring a more open-eyed look or anything I can do to make her brows feel more raised. As you can see, when she makes the angry face, her brows drop down lower and her eyelids become more hooded. I'm going to bring back that first model just to show you how the difference in brow position affects how much hooding you have to the lids. As you can see, the first model has a higher brow position, and when she engages the muscles to bring her brows down, there isn't as much hooding to the eyelids as the model on the right. Here she is after we treated her with Botox to her glabella muscles, or the muscles that bring the brows down. The pic on the left is her making the angry face as hard as she can before Botox, and the pic on the right is after we treated her with Botox. And you can see that she really can't bring her brows down nearly as low as they were before. This is the lift she got with Botox. Before is on the left, and the after is on the right, and you can observe less hooding to her eyelids. She was very happy and pleased with her results. This patient has a higher brow position and less hooding, and the hooding she does have is more related to aging changes. As some people get older, the skin on their upper eyelids descend a bit, making their eyes appear a little more hooded. Because she has fine lines to all three areas, her forehead and glabella and her crow's feet, we treated all three. Here's a before and after, and you can really see that Botox did a great job with getting rid of her lines, and she looks so much more refreshed and youthful. Observe that her eyes appear less hooded and more open. Of note, we also treated her crow's feet. That's the muscle that closes your eyes shut and gives you the lines on the sides of your eyes. In some people, treating their crow's feet can make their eyes appear more open. Now I'm going to use myself as an example. I have a very high brow position and very defined eyelid creases. I've always felt like I look surprised, and I feel like my eyes look a bit too round, too open, and I don't know, I don't think it's as sexy. I've always admired people with a little more closed-eyed look. So I love treating my forehead area with Botox or Dysport because I'm treating the muscles responsible for raising my eyebrows. And in doing so, it prevents me from raising my brows as high and looking too surprised or open-eyed. Understand that when you use Botox, you are not actually affecting the position of the upper eyelid skin itself. Looking at Blake Lively, we can see that she most likely had eyelid surgery because her upper eyelids are less hooded with less tissue density than they had before. Something like this you would achieve with surgery. And you can see she most likely had a nose job as well.
There are a lot of videos on YouTube about customizing your eye makeup according to your eye shape. And the awesome thing about getting Botox or Dysport is these results don't wash off. I hope you learned a lot from this video. Don't forget to subscribe to this channel and share this video.